Thanks, folks, for joining today. Just as a reminder, we are here today as part of the Rock Health virtual series that will be launched in partnership with the Rock Health Summit, which is on September 30th. We're very excited to start this discussion today with these great panelists. We are covering today from research to reality, advancing solutions for depression and anxiety. I think most of you who are likely attending this sort of have awareness of the increase in solutions that are appearing in the mental health space. We know that there's a lot of folks out there, purchasers, employers, health plans, that are thinking through how they pick some of these digital solutions that are appearing in the marketplace. And then we also have a whole set of investors that are thinking about where they actually put their time and energy and money and innovation into thinking about these solutions. I'm hoping that today's short conversation will sort of give you some insight into what each of these different individuals are doing. Today, we know that more than 1 in 5 young Americans and 1 in 5 individuals experience a mental or behavioral health condition. So the need for these solutions could not be more important than they are today. We're going to hear from folks that are sort of in the innovation space, in the investment space, and the evaluation space in terms of what they are doing to sort of tighten this market up, but then also give folks an opportunity to think about what they can be doing to meet some of the gaps. So to get us started, would love to do a set of introductions, a little bit about sort of who you are, who your organization is, and the unique perspective that you bring to today's conversation. And then we will get started. And Caroline, we'll start with you.
Wonderful. Thanks so much, Nelly. I'm Caroline Pearson. I'm the executive director of the Peterson Health Technology Institute. And we are an independent nonprofit evaluator of health technologies and digital health tools. And we recently released a report that was focused on digital solutions for depression and anxiety, specifically focusing on people with mild to moderate symptoms. So really excited to talk about all of the innovation and sort of what we found in terms of the clinical outcomes and economic impact of these solutions.
Great. And Mark, maybe we'll hear from you next.
Thanks, Nelly. Hi, I'm Mark Griffin. I'm the EVP and Chief HR Officer for BJ's Wholesale Club. We're a membership retail club that has about 255 stores and about 35,000 employees. And of course, my perspective is, as a head of HR, how do we make sure we're supporting all our team members that need help in this area? And as we all know, more and more need help in this area every day. And so it's becoming a bigger priority from a health and welfare standpoint, and a big priority for me as well.
Great. And Nathaan, we'll move to you.
Thank you. Great to be here. Nathaan Demers, my quick background, I'm a clinical psychologist, and then I was an operator in the behavioral health startup space for about 8 years. And now I'm a principal investor with Hopelab. And Hopelab is a nonprofit family operating foundation. And within that, our mission is to support the mental health and well-being of adolescents and young adults. And we have a ventures arm. So I'm very much bringing that investor perspective from an impact lens, but also bringing along my clinical skills and operator skills to contribute to the conversation. So thanks, and happy to be here.
Awesome. And we know that these conditions, I mean, that's the sort of the impetus of having all of you on this call. We know that these conditions affect individuals across all ages, sort of from school to the workplace. And so hoping to cover that ground today. Caroline, for folks that may not have as much awareness as to sort of the deepness of your report, what stood out the most in your recent evaluation of these two conditions and sort of your process for how you identified what those issues were?
Yeah, well, we were really focused on solutions that are being sold to sort of group healthcare purchasers. So whether that be health plans that are trying to offer solutions through their medical benefits, or employers that may be offering solutions directly to their workforce, or frankly, clinicians that are thinking about buying prescription digital therapeutics. But we're not looking direct to consumer. And, we really wanted to understand first and foremost the clinical effectiveness of solutions that are really built on digital CBT delivery. And so this includes, libraries of content, activities, exercises that people can do on their own. And so it's a very different treatment modality than what we have historically thought about in terms of one-on-one talk therapy. And I think one of the most exciting things in the report was actually the strength of the clinical outcomes. And again, in this case, we're thinking about people with mild to moderate symptoms who, may not have access to affordable mental health care, but might benefit from treatment. And we really do see that digital tools have very strong potential to improve outcomes for those individuals if they engage in them. And so, that was one of the most exciting things is actually you start to see that the world of effective mental health care is maybe broader, and the types of solutions that work are more diverse than, just one-on-one therapy with a therapist. And so that was one of the first things. And then, the question for purchasers is really sort of, what are the different configurations of solutions and what's going to be right for your patient population or your membership in need.
And so, Caroline, as we think about, and I'm going to ask Nathaan, sort of as an organization that's like thinking about innovation in this space alongside how they're investing in tools, are there like guidance and recommendations? And that's maybe like very strong terms since like you're evaluating these solutions, but for folks that may be building in this space today, whether, and you're looking predominantly at like mental health broadly in the sort of adult population, but when we think about the youth, which we know, raises to be adults and is in need of this now, are there recommendations that you noted that like folks could use as they start to build these solutions?
Yeah, so I think a few thoughts there. One, we looked at a range of solutions, some that are sort of standalone self-guided, some that integrate therapy networks, some that have asynchronous text-based therapy. There's a lot of different kind of treatment modalities. And I think part of it is the most important thing in mental health is finding the treatment modality that someone is willing to engage with. And so, really the ability of some of these solutions to put forward lots of different models of care that may appeal to different folks. Some people really want that human connection. Other people are going to feel safer and more open with, a little bit of an asynchronous or a digital engagement. And that can all be effective. So I think, thinking about how we create a range of solutions that both appeal to different patient populations, but also that people can sort of level up and down, step up and down their care, depending on their symptoms, their acuity, and what they need at that moment. That's really how we're going to get the biggest engagement and likely the biggest clinical impact.
Yeah, that's great. And Nathaan, I think this is a great sort of transition question for you as well. When you think about sort of either the tools that you are, thinking about building internally and or folks that you invest in, like what is resonating with you in this space and like how you're centering on the needs of like the youth as you think about these solutions?
Yeah, happy to dive in. A great question. And just to build off of one of Caroline's points, one of my favorite sayings is one size fits none. And the more we can recognize that, I think the better we're going to do in actually addressing a lot of these symptoms and driving engagement. So really appreciate your perspective there, Caroline. But to very directly speak to, how we make sure that these tools are resonating with young people and how we center equity from the start, when we're considering investment, we want to get a real feel for the founders and the founding team. And first question we ask is, do these folks have lived experience with the challenges? Maybe the folks have actually lived or coped with anxiety, depression, or other things. And then from an equity focus, we really like investing in historically underrepresented founders. So those are things that we can do just to start that process. But secondly, in our diligence process, we really like to get to know what is their genuine interest in supporting equity focused work. One thing that we've learned is as investors, we come on board and we have pretty significant expertise in this, but if a founding team is not interested in doing equity focused works, because in some ways it's easier to work with majority populations through traditional health plans, we're not going to convince them to do what might feel, please frame this is not how I think, but the extra work to make sure that it is resonating with historically marginalized populations. So we can greatly increase their ability and efficacy in working with those. We can help bring in pilots, we can bring in testers and all these things that can support that work. But that interest has to innately be there in that passion. So that's something we think we can very much screen for.
And Nathaan, I know your Hopelab predominantly focused on the youth, but like interested, in your experience, like where you have predominantly seen sort of the dollars flowing, like whether it's in certain, like whether it's like strictly like on digital sort of talk applications, whether it is more integrated into primary care, like where are you seeing some of that, some of those dollars flowing?
Yeah, it's a great question and a giant question, as I'm sure you know. And I can say one thing that's nice is we are still seeing venture dollars flowing into the space. So as many of us know, we saw 2020 through 2022 where there was this massive injection of capital into the behavioral health space, and things sort of tapered off a bit, but it is moving. A couple of sort of micro trends that we're seeing, and this really rolls up to larger venture trends as well, is a lot of individual investors are being a little bit more risk averse, which I know is antithetical to the venture game. But in my perspective, a lot of investors are waiting until they're seeing further traction with some of these interventions. And then with all of the challenges and sort of chaos in the world of Medicaid, one thing that we're very happy about is companies that have been successful and shown success in growing and getting reimbursed through Medicaid. Those companies are actually still seeing success in raising follow-on rounds. Where I think we are seeing some challenges and some hesitance from investors is companies that are innovating in the Medicaid space but have not proven that they can actually get that traction because there's a lot of unknowns. So that's something we're really trying to push forward and really figure out innovative ways to blend public and private dollars, because we know that Medicaid cycles, it can take 12 to 15 months to get a Medicaid contract in a state. And that might just be one state and one MCO, never mind the scale required to be successful. So we're really thinking outside the box and trying to push and support companies supporting Medicaid populations.
Great. I know the environment in that space continues to change on a day-to-day basis, so I'm sure it keeps you on your toes. Mark, shifting to you, who I think is like taking sort of, the work that PHTI has done to think about sort of these solutions that exist in the marketplace, and a lot of the comments that Nathaan provided on sort of funding, you're looking at all these solutions and thinking about like what the integration actually looks like for your population. So would love to hear, and I'm sure folks on the other end of this who are also thinking about evaluation, like how do you evaluate what's truly effective and also what is needed for your population when selecting a solution for integration?
Yeah, I mean that's the big question for a person in my role, and I would highlight the study that Caroline mentioned. It's a great study. I think it's something that if you're in the market, if you're a chief HR officer or a head of benefits or total rewards and you're interested in this area, you should definitely take a look at that because it really kind of breaks it out in a very objective way. When I look to evaluation of what's working, it all comes down, first of all, to adoption in my mind. We know that people have these issues. We know that lots of people have challenges with anxiety, depression, and mental health. And if they don't, they have a family member that does or a close family member that does. And so we know it's out there. That's not the question. What I see is the first step is you have to have a tool that people know about, so there's a communication aspect, and can access it. I love when Carolyn said treatment modality, pick the treatment modality that people relate to, right? And Nathaan, one size does not fit all or fits none. That's exactly what we're struggling with. And we've tried a variety of things where we didn't get adoption. So adoption's the first thing. And then after you have adoption, it's testing for either clinical or behavioral outcomes. What are the results of the therapy and the treatment? If you don't get people to access it, though, you don't have a chance to even get an outcome. So that's why I put it in that order. So that's kind of how I think about it. And with a dispersed workforce where the majority of our team members are on a retail floor without a company computer or laptop, we've got to access them, and they have to access this kind of benefit platform through a mobile device, their personal mobile device. And so that's an avenue that when I think of effectiveness, it comes right to mind.
And Mark, are there specific sort of tactics, I'm sure you have in your role, but that you have done to sort of really drive real engagement, whether it's like working with folks on the floor in terms of how to like download things onto their phone? Are there specific examples that folks can like think about, like what's the the workforce that they would need to sort of implement some of that engagement, those engagement
Yeah.
tools?
Well, so what doesn't work is just kind of a website link that people have to remember, no matter how much you tell them to do it. So if you think of the mobile device, now in our headquarters, it's not a problem. You could do a blast email everybody. Like I'm sitting here, I'm on my laptop today. I mean, it's easy, right? I don't worry about a connected, workforce at the headquarters. We don't have an issue there. When you think about it, it really has to be an app that you download, and then it has to be an app that reminds people or encourages people to use it when they need to use it. So we do a lot of things where we have a QR code in all our clubs. Our clubs are our stores. We have 255, as I mentioned. We have 8 distribution centers with 350 plus people in each DC, as well as the headquarters. So we have lots of these areas. And when you don't have kind of, the ability to email out a link, it's really about the mobile application. With that though, everybody has a ton of apps downloaded on their phone, and so it's how do you get people to still, even with that, we have a challenge of getting people to remember what offerings we have to help them through these issues and these challenges. We still have a lot of people that call, ask for what are we, I'm struggling with this, and we're like, geez, we try to communicate 100 times, and yet people still wonder when it's their time. Like not everybody expects to have these issues or challenges. When it comes, they may not have paid attention before because maybe they're not having, mental health challenges. Now they are, or a family member is. And so the challenge that we have, and we still have it, is how do you keep it front and center and top of mind where people know about it even when they don't need it, and so they can access it when they do. A navigator might be something that can help, right? Think of, a benefits type navigator, that one-stop shop, call in. If it's a mental health challenge, that navigator knows exactly how to help the individual, because there's healthcare plans, right? And there's other plans for mental health specifically, and there's everything in between. And I think navigating is a big challenge.
And we hear sort of just in like in general society, right? Number of sort of therapists, behavioral therapists, cognitive therapy, the number of providers, there's a huge shortage. So like how they are utilized in their different markets looks different. These tech solutions are solving for some of that. I mean, I think one of the things I'd just be interested, like both personally and from the work that you all have done, is oftentimes these tools and these therapists are like predominantly used in sort of like more privileged communities, not in a sort of negative fashion, but those are the folks that sort of know how to access them. They know how to like reach the resources. I think, Mark, to your point, they may have like more experience and knowledge with like getting something on their phone quickly, right? And getting access a little bit quickly. In some of the work that you've done, and maybe Nathaan, we'll start with you, just given sort of the population that you're also focused on, is how do we make sure these tools don't just sort of serve those like privileged individuals that like tend to have access all the time?
Yeah, it's a great question and such an important consideration that I think not enough people are asking. And again, when I think of traditional venture is going for growth and scale. And the easiest way to do so is go to people that have disposable incomes and are already aware of challenges with mental health. So again, one thing we really look for is being able to find that commitment to treating historically underserved communities. And for example, a couple of companies we've stumbled across recently are working with Medicaid populations and are providing care navigators or in-home primary care. What I love about those models is they are actually going to these populations. When we think of primary care, sometimes individuals on Medicaid, transportation can be an incredibly difficult thing to do. Or if I'm working a job or two, that can also lead to challenges. So looking for those innovators who are, going back to what Mark was saying, engagement and outcomes are important. And if we aren't thinking of how to engage folks who have not traditionally engaged with the mental health care system, we're never going to meet those people. And again, it comes down to the founding team, their passion for it, and then the questions they're asking and how they are actually engaging those folks, their target population, in the research, design, and everything that they're doing.
I think one of the other big things that we need to talk about when we think about sort of equity and expanding access to care across diverse populations is really cost. Our high healthcare costs are one of the single biggest impediments to health equity, because we simply cannot continue to, scale traditional care models at the cost that they are today and just hope that suddenly we're going to put them in the hands of all of our underserved communities. It hasn't worked, and it's not going to work in the future. And so, I think the tech solutions really bring about a fascinating opportunity here, because they do not rely on the sort of limited workforce that we have, and they create this ability to scale in ways that are cost efficient, and sort of use resources thoughtfully by deploying sort of lower cost, less human engaged solutions for people with milder or moderate symptoms, and then creating ways to step into higher level care for the people who really need it. And if we could promote sort of that efficient resource use, I think we have the ability then to be able to expand. If you look at something like the prescription digital therapeutics that are newly approved, not widely used, right? But they're sort of digital tools in the hands of clinicians. And I think most people think about them being used as sort of, patients doing homework between weekly therapy visits. But if you put those tools in the hands of PCPs, who frankly may be prescribing mental health drugs, but not getting people into sort of other treatment, or if you put it in the hands of a therapist who can actually see more patients because they can sort of meet with their patients every other week instead of weekly, that's how you start to take the existing workforce we have and then really scale it in ways that are going to be affordable enough to be relevant, in the setting that we have. As Nathaan said, like, we've got Medicaid programs facing the biggest budget cuts they've had in a long time. And so, that cost is part of the equity equation.
Yeah, and I would just add quickly, as I was thinking, and it's kind of what both my colleagues here talked about, it's access and cost. And I think from an employer perspective, we own a lot of the cost transfer control, right? So, it has to be cost effective for us as an employer to buy, but it's got to be very cost effective or free to an extent, if you will, for team members to access. In our environment, the majority of our team members, like I mentioned, are frontline retail workers, and you can't have in that environment, you can't have high costs get in the way of access to care, and so that's got to be solved by not only the point solution, but like the employer, it's as well. We have to share in that, and it can't just cascade down to the employee. Um, and I think another thing we have to think about is making sure it's a safe environment, and uh, we kind of take the stigma out of reaching out for help. And I think that stigma is up and down the economic chain. There's not a demographic that has might have more stigma issues or not. I'm not aware of, but I think just access to care and getting people to use it, making sure that they know their employer, it's a safe environment, and the employer wants them to reach out for that care, that it's okay if there's time out of work in order to access the care. And because what obviously gets in the way from an employer perspective, from a practical perspective, is productivity, attendance. If people are not, don't have their head in the game, if you will, and they're distracted with these challenges, they're not going to serve our customers the right way. They're not going to be as productive. So we have to do a better job. I think all employers have to do a better job of encouraging, taking the stigma out of getting help for mental health issues, and making it open and cost effective.
And building trust within sort of the community. I know with the youth, like many years ago, it started that like youth weren't necessarily, like, they didn't feel safe going to mental health applications in case like there was communication with their parents or things like that. But I think even with the employer setting, sort of building trust that the employer isn't going to retaliate on their mental health issues too comes up. We're actually coming to a close, and I wanted to do two sort of rapid fire questions, which I think we've sort of already addressed, but asking them in a way that sort of people may hear this and it may resonate with them. Is one thing that would accelerate better alignment between evidence and innovation? I know cost has come up in a couple different components, but Caroline, maybe we'll start with you, given sort of all the evidence that has gone into the work of this report.
Well, we would love to see more clinical evidence driving innovation and actually driving adoption. And so, I would really just shout from the rooftops that these solutions are delivering clinical benefits. And we need to deploy them in ways that are smart and efficient, but they have a lot of potential, and we should follow that.
Yeah, I'll go next. I think it's taking technology to the next level. Of course, AI is out there, and how is that going to impact this? But I think technology to drive engagement and access to these benefits, right? So I think, as Caroline mentioned, the clinical evidence is there if you pick the right program. But it's how can we leverage technology in an innovative way to take these products to where people are and make it easy for them to access it.
And sort of pulling together perspectives, Mark, again, going back to engagement and efficacy, we come across so many companies that have one or the other, but not both. And that is such a challenge. And I think it's actually all three of our roles, if you will, to do this. And Caroline, we need folks like yourself making sure that these companies are indeed doing good outcomes oriented work, because a lot of time companies are they're moving too fast and they don't do those independent evaluations. So that's so important. And then from my perspective, for you and your persona, if you will, Mark, consumers or buyers really need to be demanding that these companies are providing that evidence. I know a lot of times I've seen in sectors, folks are buying and adopting things just because there's great engagement, but they don't know about outcomes as of yet. And that's cart before the horse. And then the last one I think is incredibly important is end users. I think we have a responsibility to train end users to say, is this efficacious? Just like I think most people before they take a pill for a cardiac condition ask, like, does this work? Has this been tested? I don't think the general population is very trained to say, like, oh, well, what are the outcomes associated with this game, this therapeutic, this whatever it might be related to mental health?
Nathaan, maybe staying on that same sort of string, you had so many good sort of nuggets of information. Is you work in the space of innovation and where the funding is trending. Are there things that what gives you hope for this space, and maybe specifically for the youth, because I think they are our future and they are individuals for us to consider. And then also, and this question is so silly, but I always love to ask it, is what are the things that are sort of keeping you up at night? Not only sort of what gives you hope, but what are the things that you're most worried about outside of sort of the three pieces that you just mentioned around alignment?
Yeah, great question. I'll try and be brief because I could go on for an hour and a half, I think, which would bore everyone. So first, bright spots. I think there's some incredible creativity being applied to youth mental health. And we're thinking not just traditional clinical modalities. We're thinking upstream. We're thinking digital therapeutics and other things, which is great. But the other really nice thing is we are seeing companies get traction, show outcomes, and provide an ROI, all with decent margins in the Medicaid space. So the more and more of that we can see, I think we will hopefully be able to weather the storm that is happening now with Medicaid. And then on the other side, things that keep me up at night, again, it's an incredible privilege to be able to invest in a true impact lens. Traditional VC, again, is often moving really fast. And when you're moving really fast, it's hard to slow down and do a randomized control trial, for example, or do user testing with youth. And one thing we're working on is trying to find ways to let companies slow down to do this work right, to have both engagement and outcomes before they scale rapidly, where venture just wants to scale rapidly. So that's something that is a concern in this space. And I don't know what method is going to win, but we're doing our part to try and slow that down. But venture is a big machine that's going to keep doing what it's doing. And I hope consumers and evaluators like we have on the call can help voice and advocate for that slowing down.
And Mark, maybe we'll move to you. What gives you hope, maybe specifically with your sort of your population and the folks that you're seeing on a day-to-day basis, and then also I'm sure there are a million things keeping you up at night given your role, but what specifically to this conversation?
Yeah, thanks. I think I would start to Nathan's point, that I really have hope that there are programs and companies out there building benefit solutions in the space that combine both efficacy and outcomes with the engagement and the access point, right? So you got to be able to access it at the right time when people need it, and you have to have the right outcomes. And as he said, I've seen so many that do one or the other effectively, but not both. So that's a hope there. What keeps me up at night in this space is having a team member struggle out there with these challenges and issues and not be aware of what we have to offer and not take action and take advantage of the programs that we have in place. That keeps me up at night. The ones that do, I worry less about because we have good efficacy and good clinical outcomes. And I think that once they engage, we're all set. It's the ones that don't engage that keep me up at night.
I think what you're hearing again and again here is that the great news is that we have good treatments, right? We have good evidence-backed treatments, and we need better ways to engage folks. And so the thing actually that gives me a lot of hope in this, I'm very hopeful that generative AI and chatbots, because they are so sticky and so engaging and captivating, will really help bring people in to some of these platforms in ways that you've seen everyone sort of flock to ChatGPT, and if we can get a little bit of that sort of draw into some of these evidence-backed solutions, that gives me tremendous hope. So I'm really excited for more research coming out on that. The thing that keeps me up at night is, as we look at an area where we've got good clinical outcomes, now we need to make sure that the people buying these solutions, like Mark, are contracting for them in ways that are very much tied to those clinical outcomes. And so I have been pleased to hear a lot of interest from both purchasers and from companies about sort of shifting to performance-based contracts and really tying payments to clinical outcomes, not just to metrics of satisfaction or other scores. And that's hard work right now. So, we're doing some efforts to try to make that easier for folks. But the more we can tie the business model to the clinical outcomes that we all care about, the better we're going to be in terms of keeping companies and founders focused on what really matters.
Awesome. Thank you so much. I will just add that I think that what sort of keeps me motivated in this space is that we have folks like you that are, that each of you that are sort of leading your work with evidence and empathy and equity to continue to do good work in this space. Probably the thing maybe that keeps me up at night is a little bit of what Nathaan referenced is there are so many solutions popping up in the marketplace on a daily basis that I think for users to select what works and what is effective for their community can start to be a very overwhelming. So very thankful also for the work that Caroline and her group is doing to sort of help people make this decision a little bit quicker. I encourage everyone to take a look at that report as well, and we'll try to link it through this webinar as well. I want to thank everyone for the time. This was 30 minutes of a great conversation where you can see that folks are passionate about the work that they're doing. And I think users will benefit from this conversation as they build their own solutions as well. So thank you for your time. And yes, we look forward to talking again soon.
Thanks, everyone.
Thank you.